Hey Nick, my name is Tate.
I think.
We'll be doing an examination of your abdomen today.
Sure.
So the first part of this examination is just inspection. And I'm looking at your abdomen. I'm looking for any vascular patterns that are abnormal. I'm looking for any scars. Looking at the contour of your abdomen. I'm looking to see if it has any odd shapes to it. I'm also looking at the symmetry left and right and what the abdomen look like. I'm looking for any visible masses too, or herniations. If I were to see any herniations or visible masses, I would have you go and raise your head off to the side and cough. And I'd be looking to see if that mass stayed in the same place or if it disappeared, which would tell me something different. Okay, so now that inspection is over, the next part of our examination is auscultation, which we do first before palpation, only with abdomen, because if I were to touch your abdomen, there's a chance I could mess with vowel sounds later, okay? So the first thing I'm going to do is use the diaphragm of this stethoscope, and I'm going to be listening for vowel sounds in each quadrant, okay? Starting with the right lower quadrant and working my way around. So I spent about 5 seconds on each of those quadrants just looking for any vowel sounds. The next part of this is I'm going to use the same thing. I'm looking for bruits in your arteries. So I'm going to be looking at the abdominal aorta, the renal arteries, the iliac arteries, and the femoral artery, okay? We'll do the femoral first because it has some instructions to it. So I'll have you find your pubic bone, and then your ASIS right here. And just between those points, I'd like you to put the bell of this stethoscope, okay? Go ahead and do that. And then I'll listen for it. Just keep it off the skin. And there are no bruises there. Do the same thing on this side. Find your pelvic bone, ASIS, and right in the middle of those, please place that bell. Good, and I didn't hear any sounds with that, which means there are no bruises. So I'm going to go through to the aorta, renal arteries, and the iliac arteries now, okay? Awesome. So for the iliac arteries, I went an inch above and an inch over, an inch below and an inch over from your umbilicus. And then for the renals, I went an inch above and an inch over. And then abdominal, I just went about 2 inches above your umbilicus. All right, so the last part of auscultation is friction rubs. So I'm going to use the bell again, and I'm going to be looking for friction rubs of the liver and the spleen, okay?
Sure.
I did hear some noises, but they weren't friction rubs, which is normal. All right, now that we've done auscultation, I'm going to move on to percussion. And so I'm going to percuss, which means I'm going to put my finger and drag it through and just tap it to hear for noises. I'm listening for dullness or tympany. I'm going to start at the subcostal region. I'm going to go down to the pubis, okay? So I'm starting here. It gets more tympanic as I go down to the intestines. I like to start with the mid-clavicular and then work my way to the middle. So I'll go down the sternum now. It gets more tympanic again, skipping the belly button, continuing down below the belly button. And then I'll go to the axillary on the outside. Listening for the liver, and then it gets more tympanic in the intestines. And then same thing on the left. I'll go mid-clavicular line, drag down the spleen, a little dull, and then tympanic down into those intestines again. And I'll go mid-axillary line, tissue drag down, percussing, feeling for, or hearing for, the kidneys as it gets a little more resonant instead of tympanic there. Now that I've done percussion over those, I'm going to do margins of the liver. So I'm going to just tissue drag down from mid-clavicular line just under the nipple, and I'm percussing to find the margins of the liver. And over there. And if I had a pencil, I can mark this. Right there. Then going up. Good. There. Right there. And if I had if I had pencil markers, I could show you whether or not this is. Well, hello.
Well, hello.
We're doing a PDX video. Do you have class in here?
We do it at 1, but
oh, okay.
Let you have this room. Sorry.
No, it's all right.
We're almost done.
Okay, no worries, sorry.
I could tell you the size of your liver and whether or not it's normal, which should be about 6 to 12 centimeters mid-clavicular line. Continuing on, Nick, with our examination now that we're not interrupted, I'll go to splenic enlargement. So I'm going to go over to the left side, and I'm feeling the spleen when I percuss, looking for any of that resonance instead of dullness, which will tell me where the spleen is. Okay, and then I'll go inferior border. There. Got a healthy spleen. Congratulations. All right, moving on to palpation. I'll do the 4 quadrants, starting in the right lower quadrant. And I'm just palpating with gentle circles right here. I'm feeling for any masses or tone differences, anything like that. Moving up to the upper right quadrant, and then the left upper quadrant, and finishing in the left lower quadrant. And my second pass around clockwise will be a little deeper, feeling for those deeper tissues, and possibly even intestines, feeling for any obstructions in there. Good. And I don't feel any masses, which is good. We don't want any of those. Awesome. Now that I've done the quadrants, I'm going to have you do a McBurney's point. But before we do that, I'll just mention that if I did find any masses, I would have you bear down, and I would be able to feel if those masses were above or below the muscles. Okay. But anyways, we're going to move on to McBurney's. So we can find McBurney's between the ASIS and the umbilicus right here. So I can just push, and that would show me whether or not you have acute appendicitis. Do you have any pain there? No. If you did, that would be a sign of acute appendicitis. And the next part of this will be Murphy's sign on the edge of the liver. So I'll move around here. And I'm just going to grab under the subcostal region and have you inhale and exhale. I'm just going to increase pressure. Go ahead and breathe in and out. And I'm just feeling for the ribs, under the ribs, to see if I can feel the liver. Perfect, thank you. We can do the same thing for the spleen, which I'll do with belotomy. So I'm going to try to find it since it's a floating mass. But how about I have you lay on your left side? Want to do that? You know what? It's okay. Just stay there.
Oh, okay.
I got a little disorganized.
Oh, I'm back.
All right, here we go. All right, I'm just going to feel. Go ahead and breathe in and out and in and out. Good. And I can also do belotomy for the kidneys. Usually don't feel them unless they're a very skinny person. Nick is almost there, but we can't feel the kidneys today. Go and breathe in and out. Okay. We tried. Alright, the next thing I'm going to do is push in the left lower quadrant, and I'm going to let go. And if he feels pain in the right lower quadrant, that is the rebound test with positive Rosling sign. So I'm pushing here, letting go. Do you have any pain? No. No pain. Okay. The next test, the two are for acute appendicitis, so we'll do the obturator test first. So I'll go over to his right side. I'm going to bring his knee up like this, and I'm going to laterally rotate it so that the hip is internally rotated. And do you have any pain in that right lower quadrant? No. Okay. And then I'll have you flip over on your left side, please, with your right side up. We'll do the psoas test. I'm going to stabilize this, and I'm going to have you extend your right leg back. Good, and I'll guide it. Do you have any pain in that right lower quadrant with that? No. Perfect. So that is a negative psoas test, which means there's no acute appendicitis.
All right.
And that concludes our exam.
Thank you.
Nick.